I'd like to first ask you, as a student at the LSE, what career did you envision for yourself and what made you pursue a PhD in social policy?
My first job was in the Singapore Civil Service. Um, at the time, I found that it was an environment where policy debate was quite limited, and there were many times when I felt I lacked the tools to think about my work. Always felt like something was missing. So it sounds it sounds a bit simple, but my main motivation for going back to school was essentially that I wanted to understand my work kind of retrospectively, to make sense of what I was doing then. So that's why I kind of embarked on an MSc in public policy at the LSE. I found it a very useful program in helping me understand how governments work. And then subsequently, I switched to do a PhD in social policy to understand what policies work. I did not always envision an academic career, to be honest. But when the opportunity came along, I felt it was one way I could make my useful by studying social policy, explaining it to students, to the public, maybe, persuading policymakers, advocating for change when necessary. I thought it was maybe something I could do, and the context for this is that the academic and research community looking at Singapore social policy is very small. So it felt like although I was one additional person, it might make a difference.
That's really fascinating that you didn't start as envisioning an academic career, but then you shifted to it. So, one of the significant projects you worked on is the Social Inclusion Project, where you led the first nationwide street count of homelessness in Singapore in 2019. And it's been described as a landmark study of an issue that was hidden from public discourse until recent years. So, what inspired you to explore this issue, and why is it important to make this knowledge publicly available?
Homelessness is a policy challenge in many cities, and anecdotally, we knew that it existed in Singapore too. But historically, the government tended to be quite irritated whenever this was mentioned. I think this is something to do with the national ideology of universal home ownership and this narrative of housing success, specifically public housing success in Singapore. So it was very difficult to think and talk about homelessness. That meant there was no count. We didn't know how many homeless people there were in Singapore. It was not systematically studied, and the issue was very low on the policy agenda. It was almost invisible, like it didn't exist. I mean, to respond effectively to a policy problem, we must first recognize it, then measure it, understand it, talk about it, right? And when we do so, we can begin to do service planning, for example, in a more thoughtful way, and talk about housing policy reform and so on. But first of all, we needed to make this issue visible, right? And to push it up the policy agenda. So that was the policy kind of motivation behind the research. And from the beginning, I thought it was important to make whatever findings the study led to freely accessible to the public. And there are several reasons for this. One is that in when we talk about homelessness, there's often a lot of prejudice, and there are many stereotypes attached to homelessness and homeless people. So by making information available to people, helping people understand how people fall into homelessness, we thought we could address some of these negative stereotypes. And of course, when we build up sufficient public interest and support for an issue, I had hoped that it would encourage policy attention, maybe even policy change, right? I mean, speaking more broadly, homelessness is one policy issue, but I've always hoped that through research we can promote greater public interest understanding of and engagement with social policies in general, right? And and maybe at the back of our minds was also that by kind of modeling rigor and transparency in the way we do research, we can contribute to a different environment of policy making where important issues are studied properly and openly.
That's wonderful. So, do you think these stereotypes impact the way homelessness is dealt with? And so, you also mentioned that this could possibly mitigate that. What did you identify as potential causes for homelessness that you felt could be mitigated?
Mm. Um, one of the kind of direct consequences of stereotypes is that it makes the already difficult situation of homelessness or the hardships of homelessness even worse. So one of the many hardships that homeless people face is, for example, local residents calling the police and making complaints about somebody sleeping rough, and that person makes them feel unsafe, right? Even if the homeless person wasn't doing anything at all. So um, there's one obvious way in which stereotypes are a problem. And if we look at the issue more broadly, when people are more sympathetic and understanding of homeless people, I think it will encourage policymakers also to take a greater interest, right, in improving the policies that can hopefully help homeless people exit their situations.
Okay, we can certainly see that the study you did in 2019 had been very successful and it sparked a lot of debate. And that led you to conduct a second nationwide street count of homelessness 2 years later in 2021. So, exploring the methodology briefly, you introduced qualitative interviews to replace the survey component of the 2019 study. How has this improved the quality of your research and your understanding of the drivers of homelessness?
Well, because there was so little, there still is very little research on homelessness in Singapore. We were quite ambitious, I think, quite greedy. We wanted to collect as much data as possible, and in all the different ways that we could think of. So in 2019, the first time we did a nationwide count, we combined an observational street count with a survey that was also done on site alongside the count. In 2021, during the pandemic, we repeated the observational street count, but this time around, instead of a survey, we incorporated two additional elements. One was administrative data from temporary shelters, and then also in-depth interviews that were done separate to the observational count. And the reason was the lessons we learned from the 2019 study, which is the benefit of repeating studies, right? So you can fine tune your methodology. Um, we learned in 2019 that to do a survey alongside an observational street count actually presented quite a number of operational difficulties. So, for example, my instruction to the field workers was that if they encountered a homeless person already asleep, they should not wake the person, um, because I thought that was very disrespectful. Homeless people often find it very hard to get a good night's sleep, so we shouldn't wake people up just to answer a survey. Um, and that meant that the field workers had a very narrow window of opportunity when homeless persons were in their position but not yet asleep. Right? They missed that window and they wouldn't be able to do the survey. The setting was, of course, very unconducive. Sometimes people are lying down or already preparing to sleep, and you may be in a very dark staircase landing, for example. It's not the most comfortable place to have a conversation. So we were always limited to a very short questionnaire. Right. In comparison, in-depth interviews, they provide much more depth. And over the course of a 60 to 90-minute conversation, you can build trust, a bit of rapport, and start to discuss more personal issues to do with the family, to do with mental health, to do with survival strategies that may be quite embarrassing to talk about, right? Things like finding food, finding access to a toilet, for example. We could begin to talk about some of those things. And it was through the in-depth interviews with shelter residents that we managed to speak to a small group of homeless women uh, who are quite elusive, right, among the homeless population in Singapore. It helped us to understand the, the, the extraordinary hardships that they face, homeless women face, how sometimes this idea that family should be the first line of housing support doesn't always work. I think the interviews on hindsight, they gave the study a sensitivity and humanity that large sample and structured surveys do not always achieve.
So, what were the main distinctions you observed because of this change in methodology between the two counts?
Mm. We were able, for example, to kind of chart quite detailed pathways into homelessness. So people's housing histories um, before they started to sleep rough. So people do not sleep rough suddenly, and it's not a decision people take lightly, right? Because of the great discomfort, right, and risks also to personal safety. So in the course of the interviews, we were able to ask people, where were you living before this? And before that, and so on. And then what happened to each housing arrangement? Right? What made that particular housing arrangement break down? So we learned, for example, how people often bounce from place to place, relying on this family and that friend until people's goodwill ran out. Sometimes they rented in the open market until they couldn't afford it anymore. Some of them tried to access social housing in the public system, and then for various reasons that didn't work as well. So we were able to find common patterns in the way people kind of tried to find stable housing arrangements, but at each step they were thwarted until in the end they had no choice but to sleep on the streets. So this sort of kind of housing pathways and histories would not have been possible to reconstruct based on the short survey.
Mm-hmm. And you also mentioned that you were able to interview a group of women. So, speaking about gender parity when it comes to homelessness, do you notice any difference between the way the two genders are affected?
Mm. Women felt more at risk when they were sleeping rough. Some of the men felt like they would say things like, "We can take care of ourselves. We're okay." So sometimes they chose very dark and isolated spots to sleep for the night. The women were very unlikely to take those risks. Um, One of the conversations we had, I remember a woman who had been sleeping rough for many years told us that she still looked for a different place every night because if she repeated a location, she was afraid that someone might notice a pattern and then plan something. So she felt that just for her own safety, she need to change things every night so no one would spot her. And to do this for years, I mean, kind of the mental stress, right? Um, that we imagine she must have gone through. Um, there was that. We also found that homelessness. So after we did the first count, homeless women represent only about 10% of the homeless population in Singapore, much lower level than the UK. And I was always asked why in the 2019, after the 2019 study was published, but I wasn't able to answer because we can't talk about what didn't happen. So, but this time around, we were able to understand that one of the major reasons is that women are more likely to be to be among the hidden homeless population, by which we mean they are not rough sleeping, but they may be living with family, friends, moving around a lot in very unstable, sometimes unsafe, but sheltered housing conditions because they felt unable to take the risk of sleeping on the streets, right? That doesn't mean they are in any way better off. It just means that we don't see them on the streets, right? They often still felt um, very uncertain, very worried in whatever housing arrangements they managed to come up with because this really were not sustainable. So that was one of the key differences we learned.
I see. And I also understand that an important part of Singapore's heritage is the kampong spirit, referring to harmonious living and a sense of community. Has this been forgotten in recent years, and could it be part of the solution to homelessness?
This kampong spirit is talked about quite a lot in recent years. Um, Kampong is a Malay term for village. People talk about the kampong spirit. There's often a bit of nostalgia attached to the idea. There's some romanticization, some longing for a more organic and vibrant community of the past. So when people talk about the kampong spirit, is often to suggest that community today is not what it used to be. Um, I'm not sure that's entirely true when we look at homelessness. So, for example, the street outreach to rough sleepers in recent years has been almost entirely driven by volunteers. There's no government funding behind it. So charities and religious groups have been the backbone of this part of the work. During the pandemic, especially during Singapore's national lockdown, which we called a circuit breaker, there was a huge expansion of shelter capacity because of a sharp rise in demand for shelter places. And that capacity often came from religious and voluntary groups that opened up their premises to homeless people. And my own study was done, it was only possible to do with the help of almost 500 volunteer field workers, right? So the community has played a very big part of the progress we've seen in this area in the last few years. But I always stress that on their own, charities and volunteers cannot provide all the answers. Right? We need policy interventions. We need more responsive frontline public services. We need more shelter capacity and infrastructure. We need changes to the law, right? For example, there is still a law that allows involuntary institutionalization of homeless people in Singapore that needs to change. We need reforms to social housing, and we need measures to tackle poverty, right, in terms of wage protection, pensions, and so on. Those are the things that charities and volunteers cannot do.
Okay, would you be able to elaborate a bit on what policies you should think should be reformed in the Singapore government?
Mm. Um, one key, one key, I think, condition for people to exit homelessness is that they must have accessible and adequate housing options. And often to ask homeless people who can't even afford private rents to think about buying housing is very unrealistic. Right? That means their most likely option, most achievable option is social housing. But Singapore operates a very strictly means tested social housing sector where supply is limited and the entry conditions, the eligibility criteria are not keeping up with the rise in living standards. So the income ceiling that it imposes, in fact, has not been revised since 2003, right? In which time living standards has raised far ahead, which means in practical effect, it has become much harder to qualify for rental housing. There is also an arrangement where uh, social housing provides only studio flats. So these are flats about 30 odd square meters with no separate bedrooms. Uh, for single persons in a social housing system, two persons must must partner up and share one of these flats with no separate bedrooms. So often these are complete strangers, and to ask them to share such a tight living space leads to conflict, people falling out, and eventually is better off living on the streets. So quite a number of the homeless people we interviewed had previously tried to live in a social housing system and found it as extremely stressful, right? And they reckon that they will take their chances on the streets. So reforms to the social housing sector, I think, will make a huge difference to the levels of homelessness in Singapore.
Okay. And I think I'd like to circle into, say, the differences in attitudes to homelessness. So you've lived in the UK for some time. Do you think there's any fundamental differences in the way homelessness is viewed in the two countries and what kind of forms it takes? And do you think there's any lessons that two governments could learn from each other in terms of policy reform, like you mentioned?
I've not studied the UK situation closely. Based on what little I know, there seems to be a difference in the profile of people who become homeless. I mentioned earlier, from the data I've looked at, there seems to be more women among the homeless population in the UK than still fewer than men, but the proportion is much larger than in Singapore, which is only about 10%. There are many single parent households who are homeless in the UK, and most of these are headed by women again. Right. So in Singapore, in contrast, most homeless persons are single adults rather than families. We have found no children or young persons among the homeless population in Singapore after doing the study twice. Um, and in the UK, the largest age group among the homeless population, I think, is around 30 years old. In Singapore, is mainly single older men. I think it reflects homelessness wherever it occurs, reflects the gaps in the social welfare system and the kind of distribution of social risks among particular occupations. That most homeless people in Singapore are older men, I think is a reflection of problems we've had with low wage work, which tends to be among older people, as well as gaps in our pension system. So all that kind of manifests in homelessness. From my time in the UK, I remember homelessness being quite visible, just a physical the physical signs of homelessness. So people kind of setting up tents, cardboard shelters, and bedding, right? All sorts of bedding, sleeping bags, and so on. And I think there's a very practical reason is because of the cold, right? So you do need bedding for the night. Otherwise, it could be unsafe, right? As you know, Singapore is a tropical country, so homeless people tend to kind of uh, travel light. They don't keep many belongings on them or with them, and many of them don't have bedding, right? And they certainly don't use sleeping bags. They would go to work in the day, and then very late at night, they would find a quiet spot. They would sit down, and then they would sleep. So that means they are much harder to spot. Um, and they are only visible very late at night, and quite kind of counterintuitively, most of them are found in public housing estates. So the idea that homeless people are mostly found in housing estates is something that I think we have to contend with. Um, so those are some of the differences. I do think that in the UK, the understanding of the issue has gone a lot further than in Singapore. There's greater awareness of context. People relate homelessness to private sector rents, to housing and other benefits, to the social housing system, to local council funding for social services, to austerity measures, to spending cuts, and so on. I think all this reflects the work of housing charities and researchers. I mean, this contrasts very sharply to the Singapore situation, where the narrative of homelessness is very much about it being a family issue, the suggestion that this is a private issue, not a policy issue. Um, but there are also similarities. Both countries, I think, share an uncomfortable relationship with social housing. They have gone through a long period of residualization of social housing in favor of home ownership. So this is kind of very classic neoliberal welfare. Singapore is much more advanced in this regard, where home ownership is hardwired into our social welfare system. It's related to how people start a family, it's related to income security in old age. So housing is entirely commodified in Singapore. We only talk about the housing market, we never talk about housing rights. Rights to housing is a more prominent theme, I think, in UK housing research. Although in practical terms, I think the UK is also struggling to implement it. So, well, in both places, I think there's a lot more to do.
Those are some very interesting insights that you have, and it's fascinating to see that there are really fundamental differences in the way it's viewed in the two countries. So I'd like to talk about another study you've worked on now, which is the minimum income standard study that seeks to establish what constitutes a basic standard of living in Singapore. and the household budgets needed to meet those standards. So one would imagine that a definition for a decent standard of living differs by development levels and whether an ideological or a technocratic approach is followed. How did you navigate these differences in reaching a consensus for a definition? And how might one define a market price for more abstract needs such as social security or belonging?
The minimum income standard study was a very interesting project for us, and one that I think the social policy community in the UK would find very familiar. We in fact adopted the method from the UK minimum income standard project. We met with, received a lot of advice and support from colleagues at the Center for Research in Social Policy at Loughborough University. And we have since also become part of a global network of researchers doing this work. So we're very grateful to their help. Um, I think rather than kind of thinking about this research as ideological or versus technocratic, this work it emphasizes two things. It is empirical, meaning it draws on people's lived realities. It is also participatory, right? It relies on focus groups and diverse members of the public. So it's empirical and it's participatory. We run what is called consensual focus groups, which is a variant of focus groups in that people have to agree. So normally in focus groups, you're quite happy for people to disagree because that makes for a more interesting discussion. But in consensual focus groups, people have a task. They must come to a complete agreement. So participants across several rounds of focus groups, they first are asked to define a basic standard of living in words. This definition then provides a reference for subsequent groups that must create exhaustive lists of all the things and services that are required to fulfill both the intangible and tangible components of the definition. And we'll always challenge the participants to say why items are needed and how they are related, especially to the intangible parts of the definition. So if they say social belonging was important, right? So then we'll ask them, so think about why this thing is needed, right? What needs does it fulfill in the definition? And then participants would tell us, for example, that home decorations are a basic need because if your home doesn't look nice and respectable, then you can't host visitors, you can't have family and friends over, right? And that is an important form of staying connected. People talk about having budgets for birthdays, weddings, funerals, because that is how you stay uh, connected with your community, right? And your family. So it is by always challenging them to link the things they say are basic needs to the intangible and tangible needs they have put in the definition that we kind of translate, right, all these various components of basic needs into the prices of things. This approach contrasts with budgets drawn up by experts, which is historically another way to determine household budgets, which is to get experts to determine what are needs. We only introduce expert opinion for two things, which is food. We consult a dietitian so that what people want to eat fulfills nutritional needs, because often people want to eat very exciting and interesting food, which are not necessarily nutritionally wise. So we consult a dietitian. We also consult a doctor about healthcare needs, vaccinations, and so on, just because people don't know these things by heart, right? But other than these two areas, everything is done consensually by consulting members of the public. And one of the things, I mean, before we started this project, we also wondered, precisely like you've asked in your question, how will people agree, right? And of course, people are likely to have different kind of imaginations of what are basic needs and so on. They must have very different benchmarks. How then do they agree on things and prices? But what we've learned about this project is that people have very clear ideas about basic needs, why these things are needs, and they can agree. And now we've seen this because this method has been repeated over many years across different countries, that people even in very different cultural settings can always agree on what are basic needs. It really is fascinating.
Wow, that's amazing. And like you mentioned, the MIS methodology is prevalent in other countries, but your work is the first of its kind in Singapore, a country with no legal minimum wage. So, what are some criticisms you faced, like you mentioned, when it came to people agreeing or what the government felt about it, and how would you respond to them?
We've received a lot of feedback regarding the minimum income standard project. The media have been very interested. The public, advocacy groups, charities, businesses, and the actuarial community. Of course, the government as well. They all took a very keen interest in the findings, which is why we later on did another round of it. The first round of the study was to look at elderly households, so retirees, and then the second round of the study was to look at working age households. And over the years, we've noticed that different people are interested in the study for different reasons. The private sector tends to be very interested in the measurements of the living wage, right? We might assume that employers are most very concerned about wage costs and so on. Of course, they are, right? But I think there are a fair number of employers who believe that even while the business must be sustainable and profitable, they also want to pay their workers fairly and pay their workers a wage that allows to live well. Right, so a lot of the inquiries we receive have been along these lines. Charities and advocacy groups are very interested in the findings and how it helps to highlight consequences for vulnerable groups who live below the budget. um, the public's responses have been very interesting. There are real mix. Some consider the study as a kind of affirmation of Singapore's high cost of living. They say, I knew it, right? I always knew Singapore was an expensive city, and this study has now proven it. Some are very worried. They're worried that they will not be able to afford what the budgets say they need, especially adults, the sandwich generation who have to pay who have to support young children as well as elderly parents. They are quite anxious. Um, as for the government, they have been very cautious. I think I can say they've been very eager to stress the benefits that are provided to poorer households. They also stress the importance of work participation and self-reliance and so on. But they also acknowledge that the study provides an additional perspective. And as researchers, we welcome this whole range of responses. And they are continuing to stream in, even though we published the most recent report a year ago.
I see. And I understand that Singapore follows a progressive wage model instead of a national minimum wage. So could you elaborate a bit more on what exactly this model is and how might the findings of your study guide improvements in this model?
Hmm. Um, I mentioned earlier that the Singapore government is very wedded to neoliberal modes of thinking. So they are ideologically opposed to a minimum wage in the sense of a legal national minimum wage applied across the economy. But in recent years, I think it's become very clear that there's been widening inequality, wage stagnation at the bottom of the distribution. So even they have kind of come around. So some years ago, they introduced a progressive wage model, which is a sectoral minimum wage. And they call it, well, it's a wage ladder rather than a single level. So it's essentially a series of wage levels within specific sectors of the economy. And it says that as a worker acquires training, they then qualify for higher rungs on the wage ladder, right? But if we think about it, the workers with the lowest training who can only rely on the bottom rung of the ladder, that's essentially a minimum wage for that sector. Right? So in principle, it's about training and productivity because that's the narrative that's ideologically kind of, I think, palatable to the government. It's about productivity, not paying people just for the sake of it. Um, but in practice, it has served as a very useful sectoral minimum wage. And in 2021, last year, they announced a significant expansion of this wage model to cover, um, I think, a large majority of the lower wage sectors, for example, cleaning, security, and so on. In our own study, the minimum income standard study, we use the household budgets as benchmarks of what people need. We then calculate a possible living wage for Singapore. So if that is what people need, then based on certain assumptions about work hours and work participation, how much do people need to be paid? This again takes reference from the work of the UK MIS team, as well as the UK Living Wage Foundation that makes use of the UK minimum income standard findings to calculate the UK living wage. So we took reference from there. Um, Singapore is still at a very early stage of talking about wage protection. But it is also, I think, a time of change and therefore opportunity. And in these times, we hope that our household budgets and proposed living wage level can at least provide a starting point for discussion and additional data for policy deliberation.
I can certainly see that it is sparking many discussions, and the references you took from the MIS methodology in the UK just goes to show that there really is an international global network of researchers who are helping each other learn from each other and what can be implemented in other countries. So just to know about your future plans, you conducted the first nationwide street count in 2019 and the next one in 2021. Might we expect another one next year in 2023? What was your vision for these studies and their future direction? Particularly, you mentioned hidden homelessness. Is there anything that you might want to improve in your studies to uncover hidden homelessness and better understand it?
It's been an interesting turn of events. So just this year, the government announced that it will be conducting its own official nationwide street count for the first time ever. It's happening as we speak. This is momentous for us, from being an invisible policy issue to one that now the government takes very seriously and is putting in resources to study. We are very, very pleased. I mean, our goal was always that this counts would be a standard and regular part of policy making, like a population census or labor force survey. Right? And because of the resources it involves, it's just logistically very complex to organize a nationwide street count. It's not sustainable for individual researchers to undertake this work in the long term. So this is a good direction. Right? We've always done our own street count, observing three principles, right, of rigor, of independence, and of transparency. Right, so that means doing it to the highest possible methodological standards, um, always having somebody external scrutinize the method and so on, and publishing information about the method as well as the results. We hope, of course, that as this study changes hands, it will be done in the same spirit.
That's wonderful that you've raised enough awareness to make this a part of the national census that the government conducts. Congratulations for that. Looking back,
Thank you.
since you've been at LSE and you've had both a master's and a PhD here, how was your time at the LSE and how did it shape your thinking and the way you work?
The years spent at the LSE were, I think, although it happened not very early on in my life, they were formative years, I think, for my thinking as a researcher. I was very, very fortunate to have had the late Professor John Hills as my PhD supervisor. He died in December 2020. As a teacher, he was kind, patient, and generous. And he had a way of seeing patterns in data, finding stories in numbers, and then presenting that in a way that other people can understand. And that still shapes how I try to approach data analysis. He took an interest not just in my dissertation, but also my development as a young scholar. We had conversations about research, policy, and politics that influenced my thinking about policy advocacy. And I remember when I started working on my PhD in 2010, John had just completed his work chairing the National Equality Panel, which reported in January 2010. And that was not so long after he completed his work on the Pensions Commission, which concluded in 2006. So it was by, I think, watching how he worked and what he prioritized, um, that I learned what was important to me and what was my role as a researcher who is concerned about society.
That's certainly some really good insights that you gave for our budding community at LSC and future researchers that we might produce. Finally, something that we ask everyone on our podcast, what gives you hope?
In the UK, there is a mature policy, research, and advocacy ecosystem. Uh, People can divide the work and play different roles. In Singapore, for historical reasons, we don't have such an ecosystem. So to translate research findings into policy change, researchers often have to play multiple roles. I often say we have to provide the legs, otherwise your research findings just stop. So over the years, we've spent a lot of time getting our work out there, doing public engagements, and not just within academic circles. But I would say that after doing this for a few years, we noticed that the work is slowly growing its own legs. And some of those conversations are looping back to us. My collaborators and I, we receive requests for talks, for meetings, for interviews, for collaborations. And they come from many different places, academic institutions, charities, businesses, the media. And my favorite of them all are young students, and I'm talking about teenagers, who write to me to say they need to do a project and they've decided to talk about homelessness and they would like to talk to me. And as far as possible, I always try to say yes. They read about they read the newspapers. Some of them read our reports, and they ask very intelligent questions. They are curious. They are at the age where they feel that things can change, and that things are possible, and I've really enjoyed those conversations with them. So, what gives me hope? I think as long as young people are interested, they are reading, thinking, talking about social issues and asking questions, then there is always hope.
Wonderful. Thank you so much, Dr. Ng, for this conversation. You've given us such wonderful insights and really something to think about.
Thank you, Rida. It's been my pleasure.